Binu?
YouTube live is on.
Okay. Host.
No, I have to be host because ende kudeയാണ് YouTube live open ആയിരിക്കുന്നത്.
No problem.
Okay. Yeah. Tell me.
So good evening all. Good evening once again. Thanks for coming in large numbers again this time. Just give us a couple of minutes. Good evening all. Just give us a couple of minutes more time. let me enter all the participants. Thank you so much for coming in large numbers. A topic which has been repeated almost maybe around 18 to 20 times. But still, the popular demand for this topic is at large. Just give us a couple of minutes time. I hope you can hear my voice and the slide is being shared. I hope you can see that. Those people are in the Zoom can put a thumbs up and say yes. Yeah. Thank you so much. Thank you so much. Yes, the Zoom brush is come down. Dr. Bini, are you ready?
Yes, Joby.
Yeah. So thanks once again. Good evening to all. It's 9:34 now in India. All the international candidates, good evening, good afternoon, good morning, whatever time of the zone you are. Thank you so much for supporting online dentistry and showing the interest. This is a very many times repeated topic during the lockdown, but demand for this topic is increasing day by day. So we thought of giving one more time. Now, another one more reason is today's topic and tomorrow's topic are like a sequence. Today is the indicators of mouth breathe or clinical indicators. Every dentist, if you are practicing, you should be knowing about this. And tomorrow I will be coming with the treatment per se of mouth breathing in a new holistic approach that will be of tomorrow. So thanks a lot. And all of you know now we have moved on into the new platform, our YouTube channel. Please subscribe so that you will get notified. All the programs, you can see that. All you need to go to our learndentistry.in. The link has been given to you. Just go to there, just register for free, and all the recording versions will be there. All those things, all the upcoming webinars, all those things will be there. So at your leisure time, you can go and register and get enrolled and get notified. So this is make it simple, and even the certificates you can generate by yourself. Those people who do not want certificate, don't do that. Those people who want certificate, because we are getting response from the candidates saying that, sir, we don't need certificate. We just love your webinar. We just love to attend the webinar. fine. That option are there. Those you don't want, you don't have to generate certificate. Others who want to certificate, you can go there. There will be quiz, attend that, and then you can generate your own certificate. So we have made it very systematic. We are aiming for that. Initial hiccups were there. Please be aware with us, but it's all a practice. It's like a one-time learning. Once you do that, it's very easy. The security issues and everything will be not be there, because we have a secure website dedicated for you all, and you can anytime access the website at your leisure time. So that's how we are growing. Thanks for the enormous support that you have given. And this week is hectic. This week, one after the other day, huge webinar sessions are there today, and Saturday is the big day. Never miss that webinar, the changing perception with Dr. Vijay Lakshmi Acharya, one of the person whom should meet, one of the place you should visit when you go to Chennai. So madam is going to come, accepted our invitation. We had a Zoom meet with her, and she has specially tailored program. It's a special tailored program for the general dentist in COVID-19. So please do refer your friends who are in different parts of the world. Refer to them. You can listen to madams, and she is a big person in practice management aspect in India. So thank you, Sanjay, to talk about today's topic, 7 clinical indicators. Dr. Binu J. Abraham is the CEO of Online Dentistry. He's an orthodontist practicing in Kerala for the past 22 years. Along with him, myself, Dr. Joby, I'm a pediatric dentist, professor and head of the department, Malabar Dental College. We both started this firm, Online Dentistry, which has become online, and it became a big sensation, and hit all because of your support and motivation and continuing referral to your friends. We have grew up to 40 WhatsApp groups, still growing, and our membership is still growing on. And that's is our dedication to you. Free webinars, clinically oriented webinars is our promise. So with this, let me introduce Dr. Binu. Dr. Binu, now the stage is for yours.
Yes, Dr. Jabi, thank you so much. Are we all set? YouTube wise as well as Zoom wise, are we all set?
Yes, yes. Around 200 in YouTube is watching, and here around 300 here.
Perfect. Thank you very much, Dr. Jabi. Guys, few artists were inside a room. They were asked to look out of the window. Look out of the window and draw what they see. A few artists inside a room, they were asked to look out of the window and draw what they see. Very few artists actually looked out of the window and drew the beautiful scenery outside. You know what the majority of the artists did? Majority of the artists just drew a window. So easy to draw. No? Guys, those who are here in Zoom, why don't you switch on your video? Let me see you guys. Let me see you guys. Let me see to whom I'm talking to. Yeah. Great. Gagan Mohan, Jude. Perfect. Twinkle. Nice to see people I know. Yeah. So it makes a big difference. Thank you so much for coming in. Yeah. So very few artists actually looked out of the window and they just drew the window. Drawing a window is very easy. Guys, my topic for tonight is look out of the window. What do you mean by that? You dentists, we dentists, always have this problem. Sir, pain here, sir. Can you please have a look? So you ask the patient to sit, and the patient opens the mouth, and you look at that teeth. Your mind, your eyes goes directly to what the patient said. It must be a left here. Let me tell you, 26 years into my practice, every patient I see every day, promise, I see the patient in the dental chair and I start seeing from upper right 8 all the way here, and this complete look at mouth. When I start looking here, immediately patient says, doctor, not there, not there. It's here, it's here. I know. Just wait, just relax. Guys, I'm giving you some practice management points here. Practice management tips here. I got a WhatsApp message from a prosthodontist today afternoon. Dr. Binu, I heard about this mouth breathing clinical indicator. I'm a prosthodontist. Should I listen to it? Guys, if you are looking at human beings' mouth tomorrow onwards, this is going to be useful. One point or other. One point is this. From my professors in Kasturba Medical College, Manipal, they have told me, look from here to here. Now, what I am talking about here is even look out of the mouth. Look out of the mouth. That was 25, 30 years before looking at the teeth. Now things have changed. They are going to look out of the window. That is my point today. Look out of the window. My topic is about 7 clinical indicators which a general dentist should not miss. Whatever specialty you are in, I just don't care. If you're looking at human beings, if you're looking at people, if you're looking at teeth, you have to look at these 7 points which I'm telling you here. Actually, there are around 16 to 19 points. Dr. Joby is going to cover more points tomorrow. This is actually a sequelae, part 1 and part 2. So today I'm just giving 7 points for private practitioners in clinic tomorrow morning when a patient comes to you, whether it's a kid, whether it's an adult, I don't care. But look at these points. Point number 1, long face. Patient comes with pain. Who is looking at long face and all? Come on, what is this fellow talking about? He's sitting with excruciating pain. Okay, you address his pain, but you notice it. Don't tell it. Don't tell to a patient who is in pain about your mouth breathing and long face and all. Yeah? Don't do that. But you understand first. First point is you understand. Second point is whether you can make the patient understand. Long face. Now, how do you know whether it's long or short? Very difficult to know. It's very difficult. As a matter of fact, even for me, when a patient walks in on January and when a patient walks in on April, I might be able to compare between Jan when I saw her, she was not like this. In 3 to 4 months, what's happening to this female? So it's a comparative thing we are talking about. Don't worry. If you get that comparison, note it down somewhere. Don't even tell them to the patient because patients are not bothered about it. They are bothered about that pain or whatever they came to you with. So if you notice a long face, why can't you take an X-ray? Why can't you take a cephalometric lateral cephalogram? Patients might say, doctor, why you want X-ray and all to be taken of my daughter's face and all? Why you want all that? Guys, if you know your stuff, we are talking about getting a whole family ready for you. Post-COVID, let me tell you, practice management again. Do not expect like hundreds and hundreds of patients walking in per day and all that concept anymore. Things are changing. Things are going to change. Things has to change. Patients are now going to come very limited. They are worried about coming to a dental clinic. Even if they come, it will be like real emergency, real necessity. It's your duty to make it into other works. It's your duty to find out other stuff also. So you have a lateral ceph. Can you find out the length in a lateral ceph? Why should I find out the length? I am not an orthodontist. I'm a prosthodontist. That's a message I got. I'm a prosthodontist. Should I listen to the lecture? It seems. Doesn't mean anything. If you have a lateral ceph, in front of you, why can't you draw a line from your sella to gonion? Come on, sella to gonion is such a common thing which you've learned in BDS times. If you haven't learned, just take that simple Balaji textbook and read about sella and gonion and draw a line. It's mindset, guys. It's mindset to learn that matters. Draw a line from here to here. Then draw another line from Nasion to Mendon. Nasion to Mendon. 2 lines. Very difficult to draw 2 lines in a lateral ceph. It's not difficult. It is just the mindset. In between making too much money out of composites and veneers and all that, who is bothered about drawing 2 lines on a lateral ceph and all that? It's mindset, guys. You are dealing with a family here. You're dealing with the life of a kid here. Take 2 measurements, Sella to Gonion and Nasion to Mendon, 2 measurements. And why don't you just divide this into 100? This is the posterior. Of course, this is posterior. This is anterior. Posterior divided by anterior into 100. It gives you a percentage. And the moment you see more than 62%, why can't you tell parents that, you know what, your son has a problem of the jaw coming downward a lot? Vertical grower, why can't you say that? Why are you so stuck? Not my duty. I am a this dentist, that dentist. Why? You're a human being, yeah. You have another family in front of you. You have an obligation to the society to explain what you understood. It has nothing to do with the dentist you have. Tell them about this. Prove them with an X-ray. Why not? Your kid has a longer face. It's not supposed to be this long. You'll be surprised to see many mothers telling you, hey, doctor, you know what? I was telling my husband yesterday also the same thing. My daughter doesn't look like me anymore. She thinks she's pretty. Okay. So my daughter doesn't look like me anymore. I was telling my husband, this is not my family. Why is it like this? Now you told the right thing. Guys, we just opened up something there. Do that. My whole lecture today, it's a short lecture actually. Whole lecture is about this only. It's all about practice management. It's all about every case you see from tomorrow onwards. And then the typical theory that oligocephalic, mesocephalic, brachycephalic. I don't want to get into all that theory here. Yeah, that long phase, short phase, and all that, the meso phase and all that. So, point number 1, long phase. The moment you see a long phase, you see it longer than the father and the mother. Have that in the back of the mind at least. And after 6 months, when they come back for one more treatment, at least then you can talk, right? Now don't talk. Talk after 6 months at least, yeah. That there is something wrong going on. You never know. 2 out of 10 parents might say, I noticed it, doctor. I even took to an ENT. I even took to a physician. Nobody said about this. I knew my daughter has something wrong here. You are the only one who said that. We have seen all that. 26 years into practice, guys. Listen, it helps. Long phase. Have a look at it and get an idea whether this kid is longer than normal, longer than the father and mother, or longer than when you met 6 months before. Check it out, write it down, note it down. It helps. Second one, a retruded mandible. Retruded mandible. When the mandible is too much retruded and back like this, can you see this? Can you see this retruded mandible here? Look at that. Look at that convexity forming there. The moment you see something like that, there is something wrong going on. The problem is, how will you tell it to the patients? That is our basic problem. Patient never came with this complaint. Dr. Joby? Dr. Joby, are you there? Somebody is not unmuted. Yeah, I mean, not muted. Please, guys, please mute yourself. If your volume is on, yeah. If you're not listening to the lecture and if you're taking care of your kids, please quit. Please quit. It's a disturbance for others, yeah. Okay, so just make sure your audio is muted. Video, I only told to switch it on. I'm sorry. I only told to switch it on. Many haven't switched it on actually. Thank you so much, Gurpreet. Gurpreet, brother, I've been noticing you from last 2-3 classes. So nice to see you again and again in our classes. Apurva is there. Many people have switched off the video. Maybe they decided to just sleep a little, doze off a little. I don't know why. Dr. Vedugopal, sir. My God, senior most dentist here. Thank you so much, sir, for coming in. Oh, you're working, yeah? You're practicing. South Africa, right? If I remember correctly, South Africa. Anyway, thank you so much, yeah? Okay, so that is this audio thing coming up again. You want me to check chat what's going on with the audio? Somebody is still not completely muted. I can still hear some hits. I'm going to mute all, yeah? I'm going to mute all here. I didn't do that purposefully because I would like some people to come and talk in between and tell about how they feel. That's why I did that, but it's okay. Fine. Retruded mandible. Those who can come in the video, please do that. Let me see some pretty faces, yeah? Okay, so that's it. Good. Very good. Retruded mandible. Mandible is behind. Have you noticed that? Have you told the parents about it? Are you worried? Like, will they like it? Will they appreciate it? So, it is your responsibility to inform that there is something wrong with this mandible. This is too convex. It should not be that convex. There is something going wrong. You know what you should do to such kids? Tell such kids to bring the mandible forward. Can somebody come to the chat box and tell what do you name this procedure? What I just now told? The procedure which I just now told you, tell the patient to bring the mandible forward. All our own candidates only coming out with excellent results. FTO, VTO, functional treatment objective or visual treatment objective. That is, you bring the mandible forward, see whether there's any positive change happening to the patient. That is called functional treatment objective or visual treatment objective. The moment you have a retruded mandible, from the side and as well from the front, side as well from the front, ask the patient to bring the mandible forward, see how positive it is, see the difference in it. Now you can see parents telling, hey, now she looks like me. Doctor, what's wrong with her? I knew there is something wrong. I was telling my husband, 6 months, nobody listened to me. We can hear a lot of stories now. Retruded mandible. I've covered 2 major topics. Long face, retruded mandible. Third major point, not exactly major, but third point is something called as a nasal hump. Have you looked at the nose of your patient? Have you looked whether the nose has a tilt or not? Have you looked whether there is a hump or not? That's called a nasal hump. Have you checked all that? Have you ever checked all that? Check it out. Look out of the window is my topic tonight. Why is a nasal hump forming? Nasal hump almost always falls on a mouth breather. When the mid-phase development, is very less, when the nasal airway, nasal breathing is less, when the mid-phase development is less, you can see this area becoming compressed like that, and that hump forming, nasal hump forming. Just Google and find out. A lot to read about nasal hump forming also. So that's a classical sign of a mouth breather again. I talked about 3 extra oral signs here. a long face, a retruded mandible, and an hump here. You see these three features in your patient from tomorrow onwards. You know what? He should start talking to the kids. Hey, buddy, what time do you go to sleep? Oh, I play PUBG till 1 a.m. and then I go to sleep. I might go to sleep. I don't know when I sleep. Find out something called a sleep hygiene. Finding out something called the time of sleeping, time of getting up. How many time arousals in between? That's called sleep pattern. Why should we know? We're dentists, yeah. Just take out teeth and fill teeth. That's not what we are meant to. We are talking about a holistic approach. We're talking about the whole face here. Extraoral, three features done. Long face, retruded mandible, and nasal hump. I'm coming to intraoral features now. Once you looked at the extraoral, we are done. Let me tell you one experience here, very common experience. I'll be dealing with an 8-year-old kid here. I might be doing some fillings on an 8-year-old. Then I see this 8-year-old's elder brother standing there in the corner of my clinic like this and watching TV. What does that mean? We are talking about a chronic mouth breather there. Theoretically, you have no business to talk about that kid. But let me tell you, you have a business to talk about that kid. While working, you can ask the mother, that kid standing there is this person's elder? Yeah, that's my son there. Ma'am, have you noticed that he's always keeping his mouth open while watching TV? Oh my God, doctor, I have hit him here. I have put a band here. I've done everything possible. Stories might come. Don't feel bad to say that. If you don't say that, who will say that? Let me tell you, 8 out of 10 parents may not react to it correctly. I have seen initially 8 out of 10 parents telling me, doctor, that is the eldest son there. Don't worry about him. Okay, you just fill this in your dental chair. Oh, okay, fine. Let me do this fill. But if 2 out of 10 says they know about it, they have heard about it, they want to do something about it, that's your patient, guys. This is practice management again. They'll never forget you. And I have seen even parents telling me, doctor, don't worry about that kid. I know what you're talking about, doctor. He's a mouth breather. I know what you're talking about. He's a mouth breather. I've Googled and found out he's a mouth breather. And my uncle is an ENT surgeon. My uncle ENT surgeon, he'll tell some names around. Oh my God, that guy is your uncle? I didn't know that. So we are talking about parent so confident that they have an ENT surgeon back home taking care of that kid. But that kid is watching TV like this. So that parent literally ridiculed you in front of everybody, saying that don't worry about it. My uncle is an ENT surgeon, very famous ENT surgeon. Okay, fine, go ahead. But that parent, let me tell you, I have seen talking in another Rotary Club or Lion Club or YMCA or Weissman's talking to another parent. You know what? I went to this dentist. Actually, he was working on my 80-year-old, but he noticed my 12-year-old with the mouth open. Even my uncle ENT never told that is serious. This dentist said it is serious, it seems. You know what? They are listening to everything. Guys, we dentists are something. We dentists are just not a tool to fill teeth or pluck out teeth, guys. They listen to you. They may not accept it, but they talk out in the community about what they understood about you. I've seen so many times the many patients telling to their own peer group here and there, saying that That dentist, no, he actually even took the blood pressure of my mother and told me the BP value is high, it seems. That dentist had a stethoscope here, it seems. My God, you don't know what level they talk outside, guys. You make sure you be proud being a dentist in the first place. That is very, very important. My lecture today is actually more of practice management than dentistry. But first and foremost point, please be proud that you are a dentist. Nobody else has the, that Botox filler, the derma filler Dr. Chirag was talking about last Saturday. There are so many dermatologists doing it. Do you know one thing? Dermatologists do not even know how to hold a needle properly. Dermatologists is a group with the least surgical skill in the world. If they can do Botox and dermal fillers, we dentists with such fine hand, why can't we do, guys? It's mindset. It's just mindset. My topic today is all about mindset. So intraoral features, you start seeing an open bite. You do a beautiful filling, fluoride therapy, Pitt and Fisher seal and everything. You see an open bite, you don't tell the parent about it. After 3 months, they come back again, you see a bigger open bite, a bigger open bite. Who is responsible here? You are responsible for not telling them what is going wrong. You are responsible. You should be telling them. Open bite. The moment you see there is no proper overbite, the moment you see an edge to edge, there is something wrong going on. Now, if you're not equipped or if you do not know how to treat it, that doesn't mean you don't tell them. Tell them the fact. That's why I'm giving this lecture. Let them go to an orthodontist or a pediatric dentist. Don't worry about it. You tell them the actual fact, what is going on. A general physician might see a SGPT, SGOT value of the liver a little high. He may not know how to treat it, but he has an obligation to tell you that there is something wrong with that liver values. Why don't you meet a hepatologist or whatever? I mean, see, what I'm talking about here is your decision, your understanding of what is going on and making them understand what is going on. Next one, deep palate. How many have actually checked into the palate? How many have seen the depth of the palate? This is actually about the constricted upper arch, not the palate. The arch being constricted. You did a beautiful class 2 filling on the 6 or whatever, but did you check that the arch is getting constricted? Intermolar width getting constricted. Have you ever checked that? Check it out. It only worsens. It only worsens. Bad to bad to worse to worse. It only worsens. Who is responsible? You should be telling them that. You should be taking a intermolar width, molar to molar width. Yeah, take a scale and put in there, a divider and put in there and show them that it is constricted. I'm going to pediatricians with your kid and all that. I'm seeing a lot of youngsters here. For the senior people, you go to a pediatrician with your son or a daughter. The pediatrician will ask your son to stand on the weighing the machine, and he will write down the weight. Height, he'll write down the height. The moment he writes down the height and the weight, you will be seeing that what he's writing. It will be very curiosity will be there to know what he's writing. My daughter is 45 kilos, this, that, you read that. Then you look up, you see behind the pediatrician, there's a huge chart there with height, weight, age, correlation, underweight, overweight, and all the correlation chart there. Even if you have gone with fever, you will make sure you will ask the pediatrician, Doctor, I saw you just writing my daughter's weight as 25 and height as so and so, but according to the chart there, is my daughter underweight? So you notice that. You check. Same way, patients are watching you. Why can't you show them the actual intermolar width, actual interpremolar width, actual intercanine width? Have a chart behind you with your interpremolar width, molar width, and all that. Let them compare. My God, it's supposed to be 38. My daughter has only 25. What's going on? Why not, guys? We are good. We dentists are good. We can do a lot of stuff in your clinic. Do that. Do a lot of research. Don't do any research and don't do any studies, and then you expect patients to just come in like that. Practice is very dull. What to do? Maybe COVID, this, that. Practice will only be dull if you don't update yourself and you can equip with all the stuff possible, guys. Make them understand what is going on. Intermolar width. How many knows the actual intermolar width here? My topic today is not to teach about intermolar width, so I'm not going to get into that. It has a mixed dentition intermolar width, permanent intermolar width. It's there. You got to read, Google it. You can get it. Yeah, it's not a big deal. But I'm talking about practice management here. Make patients understand what is going on technically. Just don't say my son's teeth coming forward. Oh yeah, your son's teeth is coming forward. What do you mean son's teeth coming forward? Tell exactly how much it is coming forward. Be very specific in what you are talking. That is the point here. Intermolar width. Intermolar width normal. Intermolar width compressed. Why can't you show two pictures with the compressed intermolar width? They will look like this. Doctor, you mean to say all this is because my son is keeping mouth open while sleeping? Oh yeah, it is. It is all because of mouth breathing, I would say. But there are multiple other things like tongue position coming down, tongue thrusting, lower posture of the tongue, mouth breathing. I'm assuming and praying that all those people who have registered for our paid program on 27th September Habit is attending this program. I've told them specifically to come and attend in Zoom itself with video switched on. As told in your group of Habit 27th September. It's a beautiful program on mouth breathing, tongue thrusting, and thumb sucking, completely covered in one full day for any practitioner if you're dealing with human beings. Those candidates are supposed to be here. Those who missed it, come to me tomorrow in the WhatsApp group. I'll throw you out of the WhatsApp group. Let me tell you, I told you so clearly, you got to be listening to tonight's my topic and tomorrow's Dr. Jobby's topic. And the next week, we have another topic on the tongue anatomy, basic anatomy of the tongue. All the muscles, blood supply, intrinsic, extrinsic muscles, nerve supply, blood supply of the tongue next week. Please listen to all that. All those people have registered for the habit program next week. Okay. So that is about the intermolar width. Next. Oh, there's a small question here. There is no certificate of excellence this time because everybody is getting certificate of participation anyway. So I've decided no certificate of excellence this time. So, but this one question here, just to make the lecture monotony go off, there's a question here. Quad helix arch expander produces what type of expansion? Quad helix produces what type of expansion? Quad helix is actually a slow palatal expander, which produces something called as a dendo-alveolar expansion. It will not produce a skeletal expansion. Many a times, all you need is that dendo-alveolar expansion. Many a times, you don't need that the whole maxilla be opened up. So that's about quad helix, which is a dendo-alveolar expansion device, very commonly used in private practice. Any GP can do it because all you need to know is to find out the intermolar width, intercanine width, interpremolar width, and take that decision take an impression, send it to the lab, quad helix will come. You can expand it a little. The moment you expand it a little, let me tell you who is the most happiest guy. The moment you expand it a little, it's the tongue. So the tongue can go up better. Tongue has to be up there, not down. So that talks about that. Then the palatal depth. Palatal depth is the depth of the palate. How many times have you actually, when you open the mouth of the patient, looked at the depth of the palate? Tomorrow, if you guys are seeing a patient, please remember me. Please remember me and please check the depth of the palate. The moment you see the depth so inside, there is something wrong going on. Moment the depth is way up, way inside, what does that mean? The tongue has come down. Maxilla has compressed. Depth is up. To add on to it, if you have a thumb sucker there, all the best. So we are now talking about depth increasing with no thumb sucking just because of a mouth breather and the tongue position being low. You can see this. That's the depth of the palate. There is a separate analysis for the depth of the palate, which you can learn. Lastly, about tonsils. Oh, tonsils. Why should I talk to my parents, my patients about tonsils? Yeah, I'm a dentist. You can talk to them. You can open up and see the huge tonsil, the kissing tonsil there, and tell the parents, doctor, don't worry about it. My uncle is a famous homeopathic doctor in town. He's under homeopathic treatment for the last 10 years, doctor. Don't worry about it. You don't worry about it. You do the filling. Fine. Homeopathy, God bless. I have nothing to say about it because it is so difficult to even convince a pediatrician, convince an ENT, forget homeopathy. ENT, you refer to an ENT with a huge kissing tonsil like that. I have seen ENTs telling, don't worry, as long as your kid is not having constant infections and all that, don't worry about it, it seems. What they are looking at is whether the kid is getting constant infections. They are not looking at that kid's major growing period, 8-year, 9-year, 10-year, 11-year of that female or male's life. She or he is not breathing through the nose, breathing through the mouth. And the ENT doesn't care. As long as you don't have a infection, as long as you don't take too much of leaves from school, as long as you can eat ice cream, whatever you want, it's okay, it seems. Because they don't look at the general perspective from the dental point of view, from the growth point of view. It is your responsibility to even teach an ENT. Can you believe that? In my clinic, my team has an ENT, has a pulmonologist, as a speech specialist, of course, pediatric dentist, Dr. Jobby. We are talking about a team here looking at a kid, explaining every point about a kid. Don't be arbitrary. It is good that you meet an ENT and all that. It is a must that you have to go meet an ENT. And if the adenoids are more than 80-90%, get the thing removed. You can see an ocean of change in the kid's life. So, multidisciplinary dentistry here, understanding the whole teamwork here is another practice management point I want to cover here. End of the day, all I am trying to say is look out of the window. It is just not the teeth. It is just not the teeth we are talking about. A quick recap of what I said: intraoral, extraoral, and intraoral features quickly covered. One last point is a patient discussion. All our lectures normally end with a patient discussion. So this is a patient, 25-year-old guy came to me with the complaint of a gummy smile. On examination, all the classical signs which I told you, maxillary excess, long face, nasal hump, you name it, all the classical signs of a mouth breather here on a 25-year-old kid, 25-year-old guy. He wants his gummy smile corrected now. Who is responsible for not telling him at a young age that he's a mouth breather? Who is responsible for not telling him that he has a retruded mandible, he has a nasal hump forming, he has a long face forming? Did anybody tell him? Nobody told him. But this particular patient told me that, yeah, one dentist actually mentioned, but I didn't take it seriously. What dentist says is not taken seriously. Why? Because it is our own thing. We only created that scenario. Only a patient comes to a dental clinic. Sir, I just want to see, sir. Some patient, just want to see, sir. Just want to see. That happens only in a dental OP. Will anybody go to a cardiologist OP and say, just want to check, sir. Just want to check. Will that happen in a cardiology OP? It happens only in a dental OP. We started it. We created it. Suffer. That's all I can say. Suffer. Somebody has to change it. We got to take stuff seriously. We got to take the importance of appointments seriously. Importance of taking a proper appointment with the dentist and seeing holistically the whole face, whole mouth, and explaining everything, whether they like it or not. Whether they like it or not is the key there. It is your responsibility. Now, this patient, I can make this retruded mandible, I can make this maxillary excess flat and nice. How can I make it flat and nice? Not me. My orthognathic surgeon can make it flat and nice because he's almost 25 years. Only my orthognathic surgeon can do anything about it, not me. But he has to live with all this stuff the rest of his life. Again, who is responsible? Who is responsible for that? Some narrow-minded dentist is responsible for that. Gummy smile, beautifully covered with orthognathic surgery. Kid is going to be happy, no doubt about it. Guy is going to be happy, no doubt about it. But he has to live with all these plates the rest of his life. Just because of the 11, 8, 9, 10, 11, 12 of his life, somebody just mistook him. Somebody never mentioned about all this. Lastly, about ADHD. ADHD, anybody knows what's ADHD? You want to come to the chat box and tell me what's ADHD? I'm almost done. I'm winding up in next 7 minutes here. Did I delay myself? No, right? 7 minutes I'm winding up. ADHD. Can somebody come to the chat box and tell me what is ADHD? I'm surprised. They might have attended my class earlier, or they are just good holistic this year. Great. Okay, so ADHD is attention deficit hyperactive. Here, I want to introduce to one article by Dr. Josh Jefferson, Mouth Breathing, Adverse Effects on the Facial Growth. Mouth breathing, adverse effects on the facial growth, health, and academics and behavior. Academics and behavior. Doctor, what did you just now say, doctor? You said about academics? Now you talk about it, doctor. He's not studying, doctor. He's getting big zeros in every exams, doctor. Now parents are ready to talk. You talked about intermolar width, you talked about long face, you talked about nasal hump. They never bothered. They said about my uncle is this, that. Now you talk about academic behavior? Yeah, they are ready to talk. Parents are ready to talk. Dr. Josh Jefferson, one of the finest orthodontists I met in New York, great friend of mine. So we are both associated together with a lot of cases. Excellent personality. Planning to bring him down to one of our programs soon. Jefferson analysis, one of the finest the cephalometric analysis available. This is his article on mouth breathing and its effects on facial growth, health, and academic behavior. Very important. We're talking about academic behavior here. He clearly says lack of sleep can adversely affect the growth and academic performance. ADHD, according to Dr. George Jefferson, is the most misdiagnosed disease in the world. Read his article. So many kids have gone to psychiatrists and psychologists just because the kid is hyperactive. My son never sits in one place, doctor. He has a problem. Then pediatrician says, go meet the psychologist or the psychiatrist. Psychiatrist looks at him, oh God, he's mad, yeah. He has got ADHD. Take these medicines. Happy. Father and mother happy. He will be in one corner sitting like that, not talking to anybody. That hyperactivity, everything gone. Is that the way to treat ADHD? It's the most misdiagnosed thing according to Dr. George Jefferson. Just by expanding the maxilla and allowing the kid breathe through the nose properly, sir has changed the life of so many ADHD patients. He has changed the life of so many patients by just allowing the kid to sleep properly. Just ask your parents tomorrow, the kid that comes, when your kid sleeps in the bed, the pillow is here, the kid sleeps like this on the pillow. Morning, where is the head? Where is the pillow? Oh, doctor, it's like a clock needle, doctor. It turns around and morning the head will be here and the leg will be here. Write down all that. That is sleep disturbance we are talking about. That is due to oxygen saturation being low. I don't want to encroach into Dr. Jobby's topic tomorrow. He's going to cover all this beautifully. Do not miss, at least those people who listen tonight, do not miss Dr. Jobby's topic tomorrow, which is per se, treatment of mouth breathing. Do not miss it. And those who are interested, please enroll yourself for the paid webinar. It's a paid webinar. Yeah, all these are free. The other one is a little paid webinar, not a very costly thing for that one full day of complete mouth breathing management, tongue twisting management, and thumb sucking management, right from the psychology, why a kid is thumb sucking and how to get the thumb out of the mouth is being covered on 27th September Sunday. If you're interested, come back to us in the WhatsApp group. We will guide you on that. And then on 20th, we're talking about twin block, the mandibular advancement, the changes that mandibular advancement can bring along is coming up on 20th. So be in the WhatsApp group, you will know what we are talking about. So lack of sleep can adversely affect their academic performance. Now you got attention from parents. That's it. I'm winding up here, guys. Winding up with one clue, one point here. Just take your mobile after the lecture, not now. After the lecture, take your mobile, go to google.com. Go to google.com and type in mouth breather and enter. Do that. Do that tonight. Mouth breather, enter. See what you will, find out what you'll see in Google. You will see the answer from google.com as a stupid person. I didn't say that. Dictionary.com said that, or the google.com said that. I didn't say that. I asked my kids to do that. They take the father's mobile and Google and say, person. That affects them. Why did dictionary.com say that? There's a reason why they said that. That is due to the oxygen saturation. This is not a joke here. Check out Google now after you get out of this lecture. The moment you get out of the lecture, you have two jobs to do. One, Google about mouth breather. Two is to claim your certificate. That's important too. Yeah. Maybe put it other way around. Claim your certificate first and then come and Google mouth breather. That's up to you. But this time we have decided to keep it open for around 48 hours. Don't worry, you have a lot of time to claim your certificate. Do not worry about it. Guys, this is information being passed over here. Certificates are not what matters. Of course, it matters for many of you here. I know that, but I hope and pray that I could cover the topic given to me tonight. I could talk about looking out of the window, the importance of looking out of the window. Thank you so much, Dr. Joby. Thank you very much, Dr. Joby. Over to you.
Yes, thank you so much. Thank you so much. So if you have any technical, any support, if you want, the numbers are given. You can come to the WhatsApp group and you can criticize us, say us how you felt about it, or any more information if you want. You can note down these numbers. You can have chat with Dr. Binu also. The numbers are given. Mail ID is given. Insta is given. So thank you so much, Dr. Binu. It's an amazing lecture.
Yeah, before the chat box goes up too much, let me answer one question here. Why are they saying stupid person is one question here. That's a question to be answered to dictionary.com or google.com, not me. But that is the truth. Check it out tonight and get back to me if I'm wrong. Mouth breather, mouth space breather, and it says stupid person. Reason is, let me tell you, reason is Tara Zameen Par, or any movie which you take, any movie when you see a mouth breather, they are categorized as a stupid person, a low IQ person. So I won't blame dictionary.com on that, but I don't completely join with dictionary.com because I have IIT graduates who are mouth breathers. Okay, so I don't completely join with them, but they are not wrong. Anything else, Joby? Questions? YouTube?
The questions are very few.
These are all basically eye-opening lectures. Questions are going to be very few, I know. But tomorrow, Dr. Joby is going to be bombarded with a lot of questions because he's going to talk about real treatment of mouth breathing. That will invite a lot of questions. I'm sure about that. Right, Joby? We have seen that now so many times. But this is more of an eye-opening.
Some people are asking how to join WhatsApp group. Dr. Agash, Rohit Chaudhary, and some others are asking. Those who are listening to us, their number is given in the WhatsApp. The number is given in the slides. Dr. Binu's number is given in the slide. You can put a personal WhatsApp to him, and you can get enrolled, or even you can message us so that we can add if you are not in the WhatsApp group. The amazing thing is a lot of things are happening in the WhatsApp group. Discussion, journal links, articles, whatever you ask, you respond. We have a support team behind that. So that is the advantage of WhatsApp joining. So if you like to do that, you can send us the messages. We can add you into
that. Dr. Sharavanan has asked how to measure the depth of the palate. I have a cast here. Doctor, that requires some learning. Dr. Joby, are we covering that tomorrow? No, right? We are not going to how to measure the depth.
Not tomorrow.
Yeah, that's not very easy because you have to look at the intermolar width. You have to keep a scale of. Yeah, in our slow maxillary expander and palatal maxillary expander programs, we are covering that because you have to keep a scale on the top of this molar to this molar, and then with a divider, find out this depth. That's the palatal depth. So I know I'm showing it very crude, but there is a methodology to do that. There is a little bit of learning. You can Google a little, but again, please read more and come over, attend all these programs. The program on SME, slow maxillary expander, the rapid maxillary expander is covering all that. It's covering all. It's not a big deal. One-time explanation, you will understand.
One question is that is tonsil common in mouth breather?
Tonsil common in mouth breather? No. I would put it the other way around. Anybody with a huge tonsil, anybody who is a mouth breather, may not have a huge tonsil. Anybody who is a mouth breather may not have a huge tonsil. But Anybody with a huge tonsil is normally more towards a mouth breather. But one more point, I'm sure Joby will add to that point. It is adenoid to be looked into, not just the tonsils. Joby, you want to add to that?
Yes, we will be discussing, I think, tomorrow in detail about this
Oh, yeah.
adenoids.
That is coming up tomorrow itself. Don't wait.
Yes, yes. One question is reduced oxygen supply to brain because of obstructed airway. That was not a question, I think.
Is that a question? See,
I just
oxygen
answered
has
something.
to get into the lungs through the nose. Nose has a purifier, warmifier, a lot of stuff going on. That's why God has devised that nose. It's not to be through the mouth. You're bypassing all the step and directly going to the lungs. End of the day, you're supposed to be getting oxygen. I think, Dr. Joby, you're talking about oxygen saturation tomorrow, right? I don't want to get into that.
Yes.
Wait till tomorrow, then ask this question. Huge tonsils are reversible or not? Good question. Depends on the size again, but huge kissing tonsils, we have seen that it requires surgery. You can like shrink a little with the so-called homeo and the sprays and the steroids and all that. But eventually, let me tell you, it might require a surgery. It's a huge tonsil. You're talking about something like kissing tonsil might require surgery. Anything else?
Does nasal hum have any other significance?
Does nasal hum has any other significance?
Yeah.
Nasal hum is normally due to a narrow airway. Whenever the airway is narrow, we are talking about if the face is supposed to be growing like this, but it's a narrow mid face. See something developing here? That's what I'm talking about. If it's like the nice developing face and a narrow developing face, see this? That is what's happening with the nasal hum there. So it's mostly related to your chronic mouth breathing and mid-phase deficiency over a period of time. Annie George has asked, sleep hygiene is about oral sleep apnea, bruxism, or other things. Sleep hygiene, the word sleep hygiene is nothing but what time you sleep, how you sleep. Like you watch TV and you go to sleep like that, or you like fix a time, you stop every gadget, come, pray, brush your teeth, pray, whatever, and then go to sleep. That's sleep hygiene. And get up at so and so time, sleep at so and so time every day. That's called sleep hygiene, and there's a lot to do with sleep apnea. We are coming out with a 1 full day program on sleep apnea with my pulmonologist and my ENT coming in as guest lectures. It's coming up soon, probably should know about a sleep questionnaire. There's a beautiful sleep questionnaire available. You should be reading about that too. We'll come about that.
Dr. Mansi Chandra has asked one question. Just inquisite, how is nasal hum related to mouth breathing? How does hum comes? Does the hum gets better when mouth breathing habits are corrected?
Not exactly. If you're talking about to answer your first part of the question, how does a hum come? I already covered that. It's because of the mid phase. Mid phase is supposed to be growing nicely like that. Just look at my hand. If the mid phase is very narrow like that, look at this. To explain a very simple term, that's what I can do. It is because of the narrowness here, this area becomes very, very prominent and forms a hum there. But on an adult, you stop mouth breathing, you can't see the hum going back. Very difficult. Then those who listen to the lecture by Dr. Chirag, he's even covering hum using the latest Botox and the derma fillers and all that. That's a different topic altogether. Javi?
Another question is differential diagnosis of this. I don't know. Dr. Lipsa Agarwal has asked one question about differential diagnosis, but sorry, we don't know. What is that? Is it nasal hum or anything? You have to clarify that. And Dr. Lokesh Kumar has asked one question: how to improve oxygen saturation? I think
I should wait for tomorrow's class.
tomorrow it will be covered. Yeah. Dr. Jafar has asked one question. Huge tonsils are reversible or not?
According to ENT guys, according to homeopathic guys, they are reversible. What they talk by reversible is, are the kid out of infection? The kid was getting cold every second week. The homeo guy made it into every month. The ENT with the spray and all that made it to every second month. But understand one thing, the kid is still breathing with the mouth open. So that obstructive mouth breathing has now become a habitual mouth breathing. Dr. Javi, I'm encroaching into your topic tomorrow.
Yeah.
Guys, you should be waiting till tomorrow and then talk these questions. He's covering about this classification of mouth breathing tomorrow.
Dr. Sunil Anand has asked one of the patient has adenoids, got operated, incomplete adenoidectomy, severe apnea, will maxillary expansion will help?
Very vague question. What's the age?
Age he has not mentioned, Dr. Binu.
Very difficult to comment, doctor. Come to me personally or with the WhatsApp group, will guide you. Little vague question, doctor. I don't want to answer a sensitive area like that.
Dr. Annie George has asked one question. Sleep hygiene is about OSA.
That's what I told that. I read that.
Okay, fine. Twinkle asked one question. Any relation between macroglossia and mouth breathing?
Macroglossia and mouth. You should be answering that. You talked 3 hours last Sunday on that topic, right? 3 hours.
3 hours.
You better talk now. You better talk now.
Yeah. But whenever I talk, which may not understand because my macroglossia has got a relation, but that has to be assessed. And that is, again, interdisciplinary comes. If macroglossia is there, you have to find out any underlying reason is there. Usually macroglossia can have an underlying reason. But how will you identify there is a macroglossia is there? So there are some clinical tests to understand whether it is a true macroglossia or is it a constricted arch which you feel like there is a macroglossia. Arch is small and tongue is normal because tongue develops first, then only the arch develops. Understand? By 8
I can ask you an interesting question back to Dr. Joby. In your last so many years of experience, how many real macroglossia have you seen?
Very rare, very rare, very rare.
That covers that question. Whoever asked the question, very rare. It is the way you look at it. It's the diagnosis that matters. It's not exactly a huge tongue as you think of. In so many years, you're talking about 18 years, Dr. Joby has seen hardly how many cases you can say number-wise, Joby?
Maybe
3,
7,
5?
That's it. 5 to 7. That's not more than that.
So we are talking about a misguided concept here called macroglossia. It's just our bailing out.
Yes.
It's the bailing out by the dentist.
That's what. That has got some syndrome.
Bail for you. Your son has a big tongue. What can I do about it? It's the bail. But it's nothing to do with the reality.
That patient may have some syndromes or other things, something associated might be there along with that in those conditions which I have seen. It's not a true macroglossia alone comes. Yes, we had a webinar. Dr. Vanita has asked one question whether bruxism webinar was there. So many times Dr. Vinay has repeated the beautiful webinar on bruxism, maybe 10 to 15 times. More than that, he has repeated that, which will be coming. So stay in the WhatsApp group. All these webinars
next week, September 16th. September 16th, Wednesday, it's bruxism.
Bruxism again, bruxism, trigger points, your tongue, a lot of things are coming up in the so you can just be in the WhatsApp group. We can update you all these things. All these things will be coming. Which specialty of medicine needed to refer the patients are ENT? Okay. Which specialty of medicine you need to refer? The Jafar has asked the question. ENT surgeon says MS ENT would be better rather than DLO, diploma of laryngologist, otolaryngologist. Better than that, it would be ENT surgeon would be the best. I mean, some more. But again, Dr. Bin has clearly told you have to educate them. They don't have any idea about the conditions. You have to go and give a lecture in the ENT. They have a monthly meeting or a quarterly meeting will be there. Why don't you go and present yourself there and make them aware in their meeting? That's a bonus thing for you. That's practice build up for you. There's a question from Dr.
There is
Yes.
one question from Dr. Mandeep Shilpi
Ah.
in YouTube.
Okay.
Sir, can we look at dryness of lips for diagnosing mouth breather? Is there a relationship between lips and mouth breathing? Dr.
Oh, good.
Mandeep Shilpi, my recommendation to you is please, if 7 to 8 hours on September 27th, Sunday, is not a big issue with you, 7 to 8 hours is not a big issue with you, and what 3,500 rupees is not a big issue with you, you should be sitting through that whole program on habits and its relationships. Everything about the lip position, lip eversion, everything will be covered with hands-on. You will be drawing on multiple pictures and you will understand what you're talking about. And again, stressing the point, all my habit candidates on 27th, I'm assuming they are listening to me now. I'll ask in the group soon. Let the class get over. I'll ask in the group how many actually attended. Let me tell you guys, this is mandatory that you have to attend this. I told you tomorrow, don't miss the topic of Dr. Jobby, because for 27th Sunday program on habit, it is important. Jobby,
Yes.
can we wind up? Are we
Yes.
done?
Yeah, almost done. Almost done. Only one more question, that is how can mouth breathing corrected in adult patient? Again, the same question, which the question, the answer is the same. Answer is the same. It's all requires a lot of experience, a lot of exercises, a lot of diagnosis, a lot of cases, still a lot of talking is required, especially 45-year-old or more than that. You can't just tell them to do an exercise. You don't think that they will follow you up. There are a lot of other things that you need to take, make him understand what is he doing there. That is more important. Yes, that is done, Binu. Thank you so
Okay.
much. It's wonderful. So
It's
tomorrow,
very late, I guess. Yeah.
yeah.
Thank you so much, guys. You have around 48 hours to claim the certificate of this particular program. Please go ahead and do that. Please subscribe the YouTube channel, those who are watching in YouTube, and so that you get your notifications. Click on the bell icon, you can get the notifications of the coming up programs. Do that. It's important again. And please be in the WhatsApp group. It's now mainly for discussions and all that. Please be in the WhatsApp group. And that online website registration stuff is a one-time thing. The moment you have the username and password, it's just like going into your Gmail or whatever. You have your username and password. You can just keep going into all the webinars listed there and just keep enrolling. And certificate claiming is a self-claiming procedure. So go ahead and do that. Thank you so much. Good night. Good night, Dr. Jobby.
Good night, Binu. Good night.